Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a research and presentation series or edition. This audio podcast as part of a ZtormLabostix production. In this audio podcast today, looking at in this audio podcast today, looking at an overview in regards to as part of sort of works from 2016 and looking at issues in chronic kidney disease or CKD terminology. This audio podcast is is adapted from works from 2016, and where this audio podcast again is part of a ZtormLabostix Collaborative. So I just look at the contents in as part of this audio podcast. A bit of background, some aims and objectives. I look at the literature and looking at some of the literature and issues in brief, and then looking at definitions and classifications. Definitions and classification in context of this works, looking at CKD stages, and then looking at CKD stages and looking at acute kidney injury, and then so continuing the contents. Looking at AKI stages, looking at coding or aspects of coding, what is being postulated, discussion, implications for practice, conclusion, and then there will be a list of references or citations that listeners and viewers are welcome to refer to. So a bit of background to begin with. So chronic kidney disease or CKD is a long-standing condition or long-term condition in which reduced renal function is evident and or damaged kidneys are unable to filter blood to achieve normal physiology. And so with a growing aging population, although CKD being whereas CKD or varying forms of CKD can be identified or can be diagnosed in amongst pediatrics and young people. CKD is evidence in amongst the literature as a public health concern, if not a major public health concern. So, owing to our increasing prevalence of primary diseases or conditions, there is a high risk of developing CKD, and there are also other factors that have an impact on disease, including socioeconomic status, age, gender, and ethnicity. The epidemiology of CKD, at least in the UK, has been outlined in various guidelines and informed by primary data from primary data in the health survey for England (HSE) in around 2009 and 2010, and in through sort of guidelines through the National Institute of Care and National Institute of Clinical Excellence, or NICE. in on using estimated glomerular filtration rate, EGFR, and albuminuria. So the prevalence of CKD has risen or has increased, and there are several determinants that need to be challenged, particularly risk factors relating to primary conditions. One investigation had identified that CKD is often undetectable and often asymptomatic. However, it is recognized with other pre-existing conditions. As CKD progresses, although symptoms may go unnoticed, it can escalate to and advanced CKD. And for the purposes, as part of this overview, listeners and viewers, that advanced CKD is and will be in context of CKD stage 4, CKD stage and severity 4. So now looking at the aims and objectives. So the aim of this overview is to sort of investigate, if you like, or if you will, some of the terminology and contention surrounding CKD classification and identification, and the rationale for having a sixth CKD stage is investigated as an alternative to as an alternative to CKD stages 3A and 3B, where CKD stage 3 is subdivided into 3A and 3B, at least retrospectively. So looking at the literature and issues in brief. So evidence has described acute renal failure, or ARF, as acute kidney injury, or AKI, and acute and or chronic renal failure, or CRF. And these terminologies have been used interchangeably in amongst literature historically, and investigations that have focused on acute renal failure, or ARF, patients or recipients with an abnormal estimated glomerular filtration rate. Evidence also has record patients or recipients with a reduced baseline kidney function or renal function, where normally, or i.e. normally where EGFR estimated glomerular filtration rate is less than 45 ml per min per 1.73 meters squared. And some of the main cases that required hemodialysis, for example, were referred or had been referred to as acute, i.e. potentially between CKD stages 3 and 5, and have been associated with higher rate of morbidity and mortality. End-stage kidney disease, or end-stage kidney disease, ESKD, ESKD or CKD stage 5, is at the severe end of the condition or disease spectrum, where recipients or patients require a form of kidney replacement therapy, or KRT, for example, hemodialysis, or abbreviated as HD, until a kidney for transplantation becomes available. Again, in amongst the literature and evidence, transplantation is a solid organ transplantation is another form of replacement modality. So the issue is that there can be terminology overlap surrounding each CKD stage, and the issue is not new, but there is a requirement for a systematic review addressing issue to provide transparency and justification surrounding terminologies between CKD stages. So now looking at sort of definitions and classifications. So it is important to appreciate that there are different definitions in literature for what separates acute from chronic disease or condition. In addition to what separates chronic disease and chronic illnesses. In relating to CKD terminology, this can cause issues in classification and identification. CKD is often silent, and an increasing issue in different populations, causing immense human morbidity and mortality. An online calculator is available to check a creatinine level, creatinine being one of the main biomarkers to determine renal insufficiency, and estimated glomerular filtration rate (EGFR), which can assess renal function to confirm an initial diagnosis. Despite variations in terminology, guidelines and frameworks divide and endorse classification with a fixed renal impairment grading, so the grading being mild, moderate, and or severe. CKD is also recognized or evidenced by the prevalence of CKD stages 1 through 5, including stage 3, which is separated again into which is separated or subdivided into three which is subdivided into CKD stage 3A and CKD stage 3B, where stage 3 is categorized as where diagnoses or EGFR is between 45 and 59 mil per min per 1 meter per 45 to 59 mil per min per 1.73 meter squared, and stage 3B, CKD stage 3B, as 30 to 44 mil per min per 1.73 meter squared. However, and irrespective of EGFR and GFR calculators, evidence also indicates that CKD stage prevalence rises or increases with age, and is found to be more common in females than in males. The epidemiological importance of ethnicity has not been completely articulated. However, to inform that in amongst the evidence and literature, there is now more published works that have been that have that have been that have that have that have been that have been that have been but that have been through peer reviewed and peer review processes to inform that more research has been looking at the the importance in around aspects surrounding ethnicity in amongst associations in regard to forms of different forms of chronic kidney disease, and different forms of chronic kidney disease, and the different severities that exist. So now looking at the CKD stages sort of more specifically, and in this sort of slide, if you like, is in this slide, or in this where wherein there's a table, in this table is table 1, highlights CKD stages and classification and severity. And here is where this table is adapted from works by Hofstra, Hofstra and team from in around 2009. However, to inform that the CKD stages, classification and severity are highlighted in this table. Table 1 is in amongst literature and the evidence, where investigators and researchers will have published on different aspects of CKD, in amongst published works, and where this where and wherein the information and the basis around this is generally common in amongst a CKD literature. So to quickly inform at the same time, CKD stage 3 here in this sort of table overview, you can see here, listeners and viewers, that you have CKD stage 3, where the general range or laboratory and the laboratory reference range in context of EGFR, GFR is between 30 to 59 mil per min per 1.73 meter squared. However, subdivided it is where CKD stage 3A is between 45 to 59 mil per min per 1.73 meter squared, and CKD stage 3B is between 30, when the laboratory reference range or EGFR calculator of that EGFR or GFR calculation is shows between 30 to 44 mil per min per 1.73 meters squared. Now, generally, the classification in around CKD stage 3 is where the diagnoses falls on is within the remit of moderately impaired GFR. In a CKD stage 1, for example, CKD stage 1 and CKD stage 2, you can see that the classification is where there is renal damage or kidney damage with normal or raised EGFR or GFR, and there's and where the severity ranges between in CKD stage 1 is more than 90, where there's more than 90 mil per min per 1.73 meter squared, and CKD stage 2 is between 60 to 89 mil per 60 to 89 mil per min per 1.73 meter squared, and then CKD stage 4 and 5 are at least in amongst the literature and the evidence has been between, where CKD stage 4 is where the severely impaired GFR, and the severity lies in context of in regard to the GFR, EGFR or GFR is between 15 to 29 mil per min per 1.73 meter squared, and CKD stage 5 is less than where it's less than 15 mil per min per 1.73 meter squared, and the classification is where the terminology had used to be referred to as end-stage renal disease, but now is referred to as end-stage kidney disease. So now moving into so looking at excuse me, looking at acute kidney injury, or AKI. So over the past decade or so, there have been efforts to improve the identification and management and monitoring of CKD, and including AKI. And whilst there are 5 stages of CKD, one investigation or an investigation suggests that AKI also has 4 categories. Number one, category one, where there is vascular symptomology, a condition in which blood vessels are obstructed. Secondly, where there's glomerular sort of symptomology, where there's a histological type involving an immune element, normally associated normally associated with and has been identified in nephrotic syndrome recipients, and where there's proteinuria more than 3 grams per 24 hours, with additional symptomologies such as, for example, where there's edema and hypoalbuminemia. And thirdly, where there's tubular symptomology involving or surrounding acute tubular necrosis, or ATM, with renal impairment, and fourthly, interstitial, which is not associated with the previous 3 categories. An example at the same time could be where there is presence of eosinophils, so particular forms of eosinophils, particular hematological cells, which may be drug related and cause ARF, or acute renal failure, or again AKI, acute kidney injury. AKI is divided into 4 stages, which are also dependent upon creatinine within 24 hours and urine output. So in this table 2, now looking at AKI stages and classification and severity, there is for again where this table highlights 4 different phases, and there are in the table 4 different phases in regard to AKI stages, AKI stages, classification and severity. But there's also a sort of a description of processes. In amongst stage 1, stage 2, stage 3, and stage 4. Just to highlight that in stage 1, for example, there's an increase of more than 0.3 milligrams per deciliter in where there's evidence in amongst the suspect or high risk where there is where there is evidence of protein leaking, and where we're then looking at stage 2, stage 3, and stage 4. You can see there's an increase there's an increase in the protein leaking, of ranging from more than 2 to 3-fold from baseline up to all the way up to where all the way where suspect or high risk individuals can have symptomologies symptomology where there is anuria, where there's reduced voiding for 12 hours or more, for example, and the um, where the where this then where this would that where this then would warrant or would require suspect or high risk individuals to be on a form of KRT. So now looking at coding. So the sort of new classification of CKD stages in at least one review removes the subdivision of CKD stage 3, the subdivision of CKD stage 3 as thus 3A and 3B. So patients or recipients with CKD stage 3B would require an earlier referral to specialist care than those with CKD stage 3A. Later detection would prolong the CKD stage, and therefore intervention should occur at an earlier stage, slowing down CKD progression. Further, furthermore, Furthermore, the methodological procedures to calculate risks involved surrounding treatment and diagnostics in CKD have been investigated or have been researched. Analytical data collected or collated has looked at coded, uncoded CKD patients or recipients and the associations to CKD stages 3 through 5. The analysis identified analysis had been broken down into confirmed CKD, labeled CKD, appropriately coded, uncoded CKD, and miscoded CKD. Patients or recipients labeled miscoded CKD received treatment at a much later CKD stage, and also presented with higher risk of comorbidities. So now looking at this table as part of what is being postulated. Well, uh, in a previous in table 1 we saw the overview in regards to uh, um, the general overview in regard to CKD stages 1 through 5, looking at the classification and the severity linked to the CKD stages. In this table 3 here, there is a look at CKD stages 1 through 5, and CKD stage 1 through 5. But at the same time here, listeners and viewers, there is an added stage here, CKD stage 6. And so I'm going to spend some time going through this spend some time going through this, and that is to say that with CKD stage 1, for example, where the definition is more than 90 GFR, EGFR, excuse me, is more than 90 mil per min per 1.73 meter squared, and linked to CKD stage 1, and at the moment in amongst the literature and amongst the evidence, where there is little or sort of fragmented consensus in some regard, that the terminology in regard to terminology terminology linked to in according to public health. So stage one, though not in amongst literature or the evidence, in amongst the evidence or the literature, um, generally or through consensus. In this here what is postulated is that CKD stage one should have an according terminology, to public health, and in this here the terminology for CKD stage 1 would be community education and awareness. CKD stage 2, you have community, where there's community education and awareness, but also at the same time pre-screening and health checks. CKD stage 3, CKD stage 3, we have three again, where the subdivisions 3A and 3B. You have the terminology according to public health, or at least being postulated, is that there is where is that it can and could be referred to again, acute renal failure, acute kidney injury, and where there's albumin creatinine ratio, or ACR, or protein creatinine ratio, PCR monitoring. And then CKD stage 4, you have advanced chronic kidney disease, where where the terminology according to public health is advanced chronic kidney disease, or ACKD, with a treatment plan and options. And CKD stage 5, and recall again, listeners and viewers, that CKD stage 5 in amongst the literature is less than 15 mil per min per 1.73 meters squared, and terminology postulated according to public health here is chronic renal failure, end stage kidney disease, which is in some regards new terminology in amongst the literature, end stage renal disease, which has been utilized in amongst the literature historically, but additionally, a terminology according to public health would be where there's where amongst the terminologies there is treatment options for suspect and high risk recipients. But then in CKD stage 6, in amongst chronic kidney disease, or CKD, does not exist. However, as being what is postulated, is where CKD stage 6 would be less than 10 mil per min per 1.73 meters squared, and there is a terminology according to public health would be kidney replacement therapy, where kidney replacement therapy preparation, or where for example, at the same time, recipients who for example who decide against treatment treatments and therapies, there is a pathway in regard to palliative care. So at the same time, what's additionally being postulated is that CKD stage 3, where we have CKD stage 3 subdivided 3A and 3B. It should not be subdivided it should not CKD stage 3 should not be subdivided, since the EGFR, or GFR is the EGFR the EGFR GFR sorry the EGFR or GFR laboratory reference range, aligned to the EGFR and GFR is uh, is is generally already narrow, and so in context of implications for practice, so CKD stage 3 is subdivided as again CKD stages 3A and 3B, but number one, the EGFR ranges, GFR ranges are narrow, and two, both subdivisions need to be accompanied by appropriate terminology according to public health if the present classification and identification system continues, and or CKD stage 6, stage 6 be included, and that this replaces 3A and 3B by a single CKD stage. So as part of the discussion, so clear definitions and terminology that relate to CKD staging have been outlined in amongst the evidence and published works, but patients or recipients should know exactly what classification of CKD they have and the appropriate terminology or definition whereby they are empowered. So three main points to form as part of this as part of the conclusion to this overview. So if patients or recipients are not screened during the early CKD stages, then diagnosis is delayed, and the opportunity diagnosis is delayed, and there's delay in around the opportunity to slow CKD progression. There should also be appropriate terminologies, again according to public health, associated with all CKD stages, and there is a need for publication updates surrounding the subject, especially in amongst the pediatrics and young people renal population. So here, listeners, is a list of the references as part of this overview, and so feel free to pause this slide or this page on on social media, and where the list of publications can be accessed through databases such as EBSCOhost, and also through EBSCOhost and through sort of PubMed and Medline databases. That draws this audio podcast to a close. This audio podcast as part of a research and presentation. This audio podcast as part of a research and presentation series or edition. This audio podcast as part of a ZtormLabostix production. Thank you.